Welcome to a journey of discovery, a voyage into the world of health and wellness. Today we embark on an exploration journey, delving deep into the complicated yet fascinating sphere of nutrition, carving out an understanding of the top 5 foods known to trigger an enlarged prostate. Our focus will not only be on identification, but also on the different strategies one can adopt to efficiently shrink an enlarged prostate. The prostate, a relatively small yet indispensable organ located just beneath the bladder in men, is a master player in the male reproductive system. Despite its small size, the prostate bears a heavy responsibility. It produces seminal fluid, a crucial component of semen that helps nourish and transport sperm. This walnut-sized powerhouse is so vital that any disturbance in its functionality can have significant effects on a man's quality life. However, it's a common spot for health complications, particularly as men grow older. Over time, it's prone to numerous issues such as infection, inflammation, and enlargement. One of the most common of these is an enlarged prostate, medically termed as benign prostatic hyperplasia. This condition is often associated with discomforting symptoms, including difficulty in urination, frequent need to urinate, especially at night, inability to empty the bladder completely. As our journey progresses, we will be examining these issues in detail, focusing on how dietary habits can influence the size of the prostate. By understanding the foods that contribute to prostate, we can help guide men towards healthier dietary choices that can potentially help manage this condition. Welcome to a journey that promises to be both informative and enlightening. One of these issues is an enlarged prostate, or benign prostatic hyperplasia. Before we plunge into our list of foods beneficial for your prostate, it's crucial to grasp the basic understanding of what the prostate is and where it's located. The prostate is a small but significant gland belonging to the male reproductive system. Imagine a walnut. That's approximately the size of the prostate, although it can grow larger as the man grows older. Located strategically just beneath the bladder and in front of the rectum, the prostate is a paramount player in the reproductive process. Its task is the production of seminal fluid, a vital substance that provides nourishment and transportation for the sperm. This fluid, when combined with sperm, results in the formation of semen, which is then expelled from the body during the process of ejaculation. Given its diminutive dimensions, it's astounding to consider the enormous role the prostate plays in male reproductive health. Its size, however, does not exempt it from susceptibility health issues such as enlargement and other diseases. This susceptibility stems from its unique location and the nature of its structure. The prostate, cleverly positioned to surround part of the urethra, the essential tube that carries urine from the bladder to the outside world. As the gland grows in size with age, it can cause urination issues by pressing on the urethra. Delving deeper into the composition of the prostate, we find that it's a fascinating mix of glandular and muscular tissues. This composition, while essential for functioning, also makes it prone to inflammation and growth. Though this growth can be normal and expected, such as during puberty or the middle age, it can sometimes take an unexpected turn and lead to conditions such as an enlarged prostate, or in more severe cases, prostate cancer. Being aware of what the prostate is, its location and crucial role in male reproductive health, is the first step towards understanding how to keep it healthy. As important as its location and function is the impact that our diet can have on its health. With this understanding, let's proceed to see how certain foods can affect its health and function. As you've learned about the anatomy of the prostate, you may find yourself pondering a question that's both critical and relevant. How do you ascertain if your prostate is indeed enlarged? It's a natural concern, and here are some of the telltale signs and symptoms to help you understand better. Firstly, one of the most common symptoms is the need for frequent urination, particularly during the night. This can sometimes be an early indicator of an enlarged prostate. How does this happen? Well, with an enlarged prostate, there is increased pressure exerted on the urethra, the vital tube that facilitates the passage of urine out of your body. This increased pressure, in turn, leads to the symptom of frequent urination. Next, another significant symptom is the difficulty in starting and stopping urination. This happens when the pressure exerted by the enlarged prostate on the urethra interferes with the typical flow of urine. This pressure could cause difficulty in controlling the start and stop process of urination, which is often a clear indication of an enlarged prostate. Additionally, you might also notice a weaker or slower urinary stream. This is not to be dismissed lightly, as it can be another potent signal of an enlarged prostate. The degree of weakness or slowness in your urinary stream could provide a helpful clue to your healthcare professional for diagnosis. Moreover, you may experience a sensation of pain or a burning feeling during urination, or even during ejaculation. These symptoms, although discomforting, are important signals denoting potential inflammation or an infection. It is critical to note these symptoms and share with your healthcare provider. Lastly, a pervasive feeling of not being able to completely empty your bladder might trouble you. This symptom, if persisting, can lead to urinary tract infections, exacerbating the situation. If you experience any or a combination of these symptoms, it is of paramount importance that you consult with a healthcare professional promptly. They are equipped to provide a proper diagnosis and suggest appropriate treatments. Always remember, early detection and proactive management can play a pivotal role in ensuring your health and well-being. Now let's move on to discuss some foods that can potentially lead to an enlarged prostate. Voiceover. Before we delve into foods that can potentially lead to an enlarged prostate, let's first comprehend in detail the causes behind the enlargement of the prostate gland. There are several noteworthy elements that contribute to this medical condition, and it's essential to be thoroughly aware of them. The primary and most significant factor is age. The majority will endure a certain degree of growth in the prostate gland as they advance in age. This is fundamentally a part of the biological aging process. Nonetheless, it's critical to clarify that this does not signify that each and every man will necessarily develop an enlarged prostate, a condition medically recognized as benign prostatic hyperplasia. Proceeding further, we shall take into consideration the influence of hormones. As men mature with age, there can be noticeable changes in their sex hormones, which can potentially stimulate the growth of the prostate. This predominantly includes an increase in the hormone estrogen or a reduction in the hormone testosterone. These hormonal fluctuations can significantly affect the size of the prostate gland. In addition to the aforementioned factors, genetics also plays a substantial role, carving a path for men with a family history of prostate problems to be more likely to face similar issues. If your father or brother has encountered prostate issues, it becomes even more imperative for you to be knowledgeable about the symptoms. It is also advisable to take preventative steps to maintain good health. Grasping the underlying causes of an enlarged prostate can guide us to make more and beneficial choices about our dietary habits, lifestyle, and overall health. This knowledge also highlights the paramount importance of regular health checkups, especially as we age. Regular monitoring can help detect any changes early and allow for prompt medical intervention. As we've gained an understanding of the causes, let's now shift our focus to the dietary aspect. Let's unravel some of the foods that can potentially lead to an enlarged prostate. So, what are the top 5 foods that could lead to an enlarged prostate? First on the list are red meats. Known for their rich, succulent flavors, red meats like beef, pork, and lamb are often the centerpieces of our meals. But they are also high in saturated fats that have been directly linked to the development of prostate enlargement. While this certainly doesn't mean you to abandon your love for steak and burgers, remember, moderation is invariably the key. Second, we have dairy products like milk, cheese, and butter. These staples provide essential nutrients, but their high fat content can, unfortunately, increase the likelihood of prostate issues. It's not about complete abstinence. It's about training the palate to enjoy these things sparingly. Third on the list is a common culprit, canned foods. They're convenient, they're accessible, but they often contain bisphenol A, or BPA, a harmful chemical that has been linked to various prostate gland disorders. Switching to fresh produce might require a bit more effort, but it's a small price to pay for better health. Fourth, we have alcohol. While a glass of wine with dinner or a pint of beer after work might seem harmless, excessive consumption can lead to dehydration, which may exacerbate prostate conditions. The secret? Savor every sip, don't rush. Lastly, we arrive at the spicy foods that add a zesty zing to our meals. While they might add a kick to your meals, they can also kick up inflammation in your prostate. Now that we've identified the culprits, how can we fight back? Let's unravel the strategy. The first measure to increase your intake of fruits and vegetables. These are treasure troves of antioxidants, known for their ability to combat inflammation in the body, including the prostate. They act like warriors, warding off harmful elements and boosting your overall health. Further, rich in omega-3 fatty acids, like fish and walnuts, deserve a special mention. What's interesting about omega-3s is that possess anti-inflammatory properties. They can help counterbalance the effects of the unhealthy fats we discussed earlier, thereby fortifying your body against potential health risks. The next part of the strategy lies in hydration. Hydration plays a crucial role, often underrated. Drinking plenty of water can act like a purifying system. It helps to flush toxins out of your body and maintain a healthy prostate. The water you consume can serve as a natural detoxifier, paving the way for a healthier you. To conclude, remember, health is wealth. The food choices you make today can have a profound impact on your health tomorrow. So, choose wisely. In conclusion, certain foods are known to contribute to an enlarged prostate, including red meats, dairy products, canned foods, alcohol, and spicy foods. Allow us to delve a bit deeper into this topic. Red meats, especially those high in saturated fats, have long been associated with an increased risk of prostate complications. Dairy products, which are often high in calcium, can also contribute to prostate enlargement if consumed in excessive quantities. The same goes for canned foods. They typically contain a high amount of sodium, which can lead to prostate enlargement. Meanwhile, alcohol and spicy foods are known to irritate the prostate, worsening the symptoms of an enlarged prostate. Contrastingly, a well-balanced diet can alleviate these issues. Consuming a variety of fruits and vegetables, which are packed with the essential vitamins and minerals your body needs, can boost your overall health and well-being. Particularly, foods rich in omega-3 fatty acids, such as fish and nuts, are proven to be beneficial for prostate health. Drinking adequate water is also important. It not only helps to flush out toxins from your body, but also aids in maintaining the balance of important minerals. By combining these dietary changes with regular exercise, you can significantly reduce the risk of an enlarged prostate and improve your overall health. Thank you for joining us on this journey of discovery and knowledge. Until next time, stay healthy, stay informed. If you've been diagnosed with an enlarged prostate, it's natural to wonder about your treatment options. Rest assured, there are several recovery paths customized to your unique health needs. First, medication. Different types of medication can help manage enlarged prostate symptoms. Alpha blockers, for instance, help relax the prostate muscles, easing urination. 5-alpha reductase inhibitors can shrink the prostate over time. Your healthcare provider will help you consider each option's pros and cons. For severe cases may be necessary, ranging from minimally invasive procedures to complex surgeries. The decision for surgery is a significant one and needs in-depth discussion with your healthcare provider. Moreover, lifestyle changes can significantly manage symptoms. As we've touched in our previous scenes, diet and exercise are key. A balanced diet rich in fruits, vegetables, and omega-3 fatty acids supports prostate health. Regular exercise is also beneficial. It's crucial to discuss these options with your healthcare provider. They can provide you the most accurate and personalized advice based on your condition. Your health is your right, and you should be informed and involved in your treatment decisions. In our next final scene, we will wrap up our discussion on prostate health. Until then, stay healthy, stay informed.